Hi there, future doctors. I hope find you well. I am Dr. Salam Mhamdi, anesthesiologist intensivist at Sahlul Academic Hospital, associate professor in anesthesiology and intensive care, affiliated to the Faculty of Medicine of SUS. Today, I'll give you the secret of fast fluid infusion through an example of physics applied in medicine. In real life and everyday work in hospitals, we know that in a bleeding trauma patient, a large peripheral IV line can give fluids faster than a central line. The reason is a 19th century physics law called Poiseuille's law. Poiseuille's law defines the laminar flow rate, Q, of an incompressible viscous fluid through a cylindrical pipe. It states that flow is directly proportional to the pressure difference, delta P, and the fourth power of the radius. It is inversely proportional to the viscosity, eta, and length, L. As you can see, Q, the amount of fluid that you pass through a pipe, is equal to pi multiply delta P, the difference of pressure, multiply the fourth power of the radius divided by 8 eta L, where eta is the viscosity, L is the length of the pipe. Now think of the line that you use to infuse any fluid or transfuse blood as a pipe. It can be central line, it can be a peripheral line. As I mentioned, think of the peripheral IV cannula and the central line as types of pipe. And according to Poiseuille's law, the amount that we can pass through this pipe is equal to pi delta P, difference of pressure, the fourth power of the radius divided by 8 eta L, where eta is the viscosity, L is the length. And as you know, cannulas are shorter than central lines, so L is small, so Q will be big. But with the central line, which is longer, we divide by a big number, so Q is less. That's why shorter tubes give more flow, especially when the radius is large. It gives dramatically more flow. And that's why in trauma or shock, we often place large bore peripheral cannulas. They can deliver fluids faster than central lines. We came to know that with the same radius, peripheral IV cannulas give faster and more fluid than the central lines because they are shorter. But there are other clinical applications of this Poiseuille's law. When you raise the IV bag higher, flow increases because the pressure difference increases. As you can see in the equation, delta P exists in the upper part of the ratio, numerator. So Q will be bigger. Thick fluids like blood move slower because viscosity increases resistance. And even if we think math also, eta is big and eta exists in the bottom part of the ratio, meaning the denominator, Q will be less. Narrow catheter, slow everything down. In conclusion, when a patient is crashing, think physics. Big bore, short line, bag high. Thank you and goodbye, and see you in future short videos in this series of medical educational videos.